understanding through storytelling. Wow, that made a difference. So let's get started. Thank you.
Thank you. Good morning, everyone. It's great to be here this morning. We'll talk about the Medicare, and then there will be questions that you guys can ask me throughout. So this is going to be Medicare 101. So for those of you who've already have been in Medicare, you might already know about the Medicare, but now, of course, as you know, we're coming towards the OAP, Open Enrollment Period, which is going to be October 15 to December 7. And we'll dive and talk about that too, how you can change your plan and how does it work in some of the system-wise. All right, I'll talk a little bit brief about the Senior LinkAge Line. The Senior LinkAge Line is statewide services of Minnesota, Board and Aging. We have also housed within 6 area agency in aging. Trellis happened to be one of the center. We are also experts in health insurance counseling and long-term care options counseling. And we do not sell, market, promote, or endorse any health insurance or product. So one of the things that I want you guys to know from the beginning, the Senior LinkAge Lines, we are free, meaning that any services, any presentation, any education that we provide today, we are funded by federal and state dollars. We're neutral, meaning that we do not promote any organization or health insurance over other. We're also objective. Anything that we provided for the information for today is for your help, for your benefit, and you pick and you choose what works for you. Areas of our expertise are care transitions, Medicare, health insurance counselings, long-term care option counselings. We also, of course, obviously help with application and form assistance, long-term care partnerships, and healthcare fraud and waste abuse, and also one of our presentations. And we have statewide volunteers also. If you're interested to become one of our volunteers, you should definitely do so, because we wanted to spread some of the resources through our Senior LinkAge Lines to statewide, and as well as also some of the community where we have not been rich in the past. All right, you can contact us, definitely. You can call us Monday to Friday, 8 a.m. to 4:30 p.m. In person, we have also a health insurance counseling teams that can sit down with you with one-on-one. We have 34 sites within 7 counties. Any those sites, our site location that is near where you live, you can pick one. And also, if you're not wanting to do it in person, definitely you can do also over the phone. This is also website. It's pretty much about the Senior LinkAge Lines, mn.gov, Senior LinkAge Line. You can dive a little bit more into this website and do your own navigations. Volunteers opportunity, as I said, we have a very wide areas that volunteers can support and help us. Some of the volunteers can also do a public presentations. We do lab and practice, and whenever you're ready, you go out into the community, you provide those presentations. And we do mileage reimbursement. We have volunteers that do a tabling events, and we have volunteers that help also with administration assistant. Excuse me. Now we'll dive into the Medicare. I hope, is there everyone on Medicare in here? Or not yet? All right? You guys, all right. You guys are already experts, so. All right, let's dive into the Medicare. So Medicare is a federal health insurance that begins in 1965 for the people who are 65 years of age, and also people under age of 65 with a certain disabilities, or maybe if you have been on 24-month on Social Security disability, or people with LIS, also known as a Lou Gehrig's disease, without waiting 24 months. And one of the things that I wanted to say, Medicare never tended to cover 100%, so it was always 80%, and we'll talk about also how do you pay for the other 20% out of the pocket. This is a Medicare card, so this is what it usually looks like. For those of you, when you first time received, you get it from your Social Security. So the way it works is that once when you turn 65, you enroll yourself. So if you enroll yourself for the Social Security, or maybe if you start receiving your Social Security benefit, they will enroll you automatically on Medicare. But if you decided to continue to work, we'll talk about that as well in an upcoming slide. Decided to work behind 65 years of age, and you wanted to delay your Part B premium, you can sure do so by signing this card and returning back to the Social Security. So we'll encourage you folks to keep this card in a safe place, only used to show enrollment, and then this is you get Part A and Part B, and do not destroy. If you do so, you can definitely get the card. You can order it on Social Security, ssa.gov, by going on the website. Medicare has a 4-part. So there's Part A. Oops. What button did I press? Sorry. So there's Part A that covers the hospital, and Part B is for physician, doctors, and then of course Part D, prescription drugs, and then Medicare Advantage, which is Part C. Go ahead.
I have the A and B card. I don't have a D.
Oh, D doesn't come with it. You know, D is a standalone drug, so you actually have to, if you are an old joint Medicare, so it doesn't come with the Part D, so you have to buy a supplement on the side, which is, could be Medigap policy. So we'll talk about that too. Yeah, so if you were to go on Medicare Advantage, which is also a similar, they do similar coverage to a old joint Medicare, where in Medical Advantage, actually Part A, Part B, and also Part D, it includes all 3-part. With the Medical Advantage also, it covers some of the services doesn't cover it within old joint Medicare, such as, visions, food routines, eyeglasses. So those are not covered within old joint Medicare. All right, here's the Medicare coverage options. So old joint Medicare Part A, as I said, it covers the hospital's insurance, and Part B, medical insurance. And of course, now you have an option to go with Medigap policy. So as I said, remember, Medicare only pay 80%. The 20% that left out, you pay out of the pocket. And that's when you go with either Medigap policy or Medicare Part D drug coverage. And Medicare coverage option 2, here's option 2, Medicare health plans. So now we can look and compare both. Medicare Advantage, so it includes Part A, Part B, and Part D, additional benefit where there's no in old joint Medicare. So also Medicare cost plan. So the cost plan doesn't really, it's only in 21 county within a state. If you live in 21 county within a state and you can definitely interested to go on a cost plan, you can, but we'll talk about those also, those 21 counties within a state where it's, if in case if anybody moved. No. So we'll talk, we'll come and I guess in, I don't know exactly what it's like, but we'll see that in map and also the list of the counties. Yes. The Advantage plan, yeah, because it's just the additional benefits where there's in old joint Medicare there isn't cover as much. All right, now when we look at this, we are on slide 13, looking at the cost convenience coverage. You have options number 1, old joint Medicare and plus Medigap policy. So you pay higher premiums and lower out of the pocket with the cost. And then also Medicare cover benefits can only use all the Medicare providers and can buy standalone Part D, of course, with or joint Medicare. Now, when you look at option number 2 with the Medicare health plans, it's a lower premium, but higher out-of-the-pocket cost with the Medicare health plans. And then covers additional benefits. Providers networks may require with approval of the referral. So with Medicare health plans, which is a Medical Advantage, it actually requires you to stay within the networks. It might require you to get approval from a doctor. It may include the Part D, where in the original Medicare doesn't have no Part D, unless you have to buy standalone drugs. So now this is, when you decided to enroll in Medicare, this is some of the questions you ask yourself first. Do you work for a small employer? So what is a small employer? So it has to be 20 plus employee. Do you contribute to the health saving account, which is a non-tax exempt? So IRS do not want you to continue do a contribution to your health saving account if you decide to go on Medicare. And then when will the coverage be ending? So if you continue to work beyond 65 for your employer, and you're asked that question, it's like, when is the coverage end? So as soon as you figure out when is your coverage end, you can definitely enroll in Medicare. But this is the question you ask, and if you're yes to all those questions, you should be enrolled in Medicare. But if it's no, you should enroll. If it's yes and you decide to wait, you can definitely wait as well too. 20 plus employee. All right, we'll talk now about the group health insurance medical enrollment. So this is like what I was saying earlier. So if your spouse and you yourself continue to work beyond 65 of age, you can, so as I said, employer, 20 plus employees, you can stop. So you can continue work. That's definitely all you have to do, just delay Part B. But if you decided to go on the Medicare, then you have to start making a payment to the HSA, which is his saving account. What it'll do, and also what the reasons why you need to start making a payment with the health saving account, it's because the Medicare can go back 6 months in parallel and pay some of the your cost of your bills. So that's what you need to have stopped earlier. All right, this is also a health group insurance, and this is like when you now decided to retire and to go on Medicare, so you have an 8-month special enrollment. We'll talk about when you first eligible, and we'll talk about all the time of the period, but this is now you have 8 months after you decided to work or to retired. And this period starts when your group coverage ends, or maybe at workplace, they might say that, oh, we are no longer doing a coverage for your health insurance, so you can definitely go off and go on Medicare. And one thing is like, you're not going to be, subjected to a Part B premium for delaying it or for penalty, because if you decided to not report and continue delay Part B, and there's a penalties 10% additional to the premium that you pay for the lifetimes. This is a Medicare open enrollment period. The initial, it's when you first become eligible to the Medicare, meaning that when you turn 65, you have a 3 month before your birthday, and then 3 months after, and then which also with the month of birthday, that's a total of 7 months. When you are enrolled or applied on Medicare 3 months before, so on the month of on your birthday month, the beginning of the month, regardless, let's say if I were to say that I'm turning October 25, 65. So if I were to apply and go on Medicare by September beginning or August beginning, so October 1st, that's when it effectively started. General enrollment, this is like January 1st to March 31st of each year. And open enrollment, as I said, is October 15 to December 7 of each year, each of the year for the Medicare. And definitely this is the time if you decided to change your plan, or maybe wanted to buy additional a medical policy or additional plan, you can go on this time. So this period of time is each year that when you can decide to enroll and to change your plan. Maybe you wanted to check much of your plan. A special enrollment period, and as I said, this is when it's only when certain circumstances happens and you qualify for the special enrollment. Medicare Advantage plan enrollment, of course, obviously, that is January 1st to March 31st of each year. This is the initial enrollment period, as I said earlier. So 3 months before birthday, and then your coverage will start on the first month of your birthday month, and then 3 months after. So total of 7 months. And this is also people with a disability. So they have, if they have been on 25-month on Social Security disability, so they can go on Medicare 3 months before the 25th of month on being in Social Security disability, and then 3 months after.
Can we ask questions further?
Sure.
So this sounds like two different things. Coverage begins the first day of the month of 65th birthday. Coverage begins the following month, so I'm confused.
Ye-
Is it the first day of your birthday month or the month following?
Well, let's say October 21st is my birthday, and then that's when I turn 65. So 3 months after, that means that September, August, or July, if I were to apply between one of those days, so sure. So 3 months after means like if my birthday is October 21st, and if I were to go on Medicare, apply for Medicare, either September or August or July, so October 1st, that's when my coverage begins. So if I did not apply those 3 months, and then I started applying on October or November, let's say I did it November 2nd, so my coverage will begin December 1st. That's what it meant. So 3 months after, and then 3 months before. If you did it 3 months before on your birthday month, the first day, that's when your coverage begin. But if you decided to wait and you apply like 2 months after or 1 month after your birthday, so the coverage will begin on the following month on the first day. So good question. All right, the original Medicare Part A, excuse me. So it covers inpatient hospital, not observations, skilled nursing facility, home health care, hospice, and blood coverage. This is the original Medicare Part A. And here is for 2024, original Medicare Part A cost sharing. So for Part A, hospital deductible is $1,632, but next week we'll definitely have the 2025 update. This is 2024, so this is only for this year, but for 2025, we'll definitely have the annual update. If you guys are interested, we'll have that as well. So this shows with original Medicare Part A cost sharing. So if you were to be in hospital from day 1 to day 61, they will definitely they cover. But any day after 61 to 90 days, you'll pay a co-insurance per day for $408, and then per day. Yep. So any days, a day from 91 to 150, it will be 816 co-insurance per day. So what this means is the annual deductible $1,632. This is for also benefit period. So this is only for the benefit period. It means like if you're to be in hospitals, then you pay the deductible $1,632, and then the benefit period ends. And let's say after 6 months now, again you come back to the hospitals, you might pay also Part A hospital deductible for that numbers. The skilled nursing facility co-insurance from day 1 to 20, and that would be they will be covered. But then any day from day 21 to 100, you pay a co-insurance of $204. Home health care, there's no cost to that, and hospice services. So those is like the cost sharings of Part A. Now we'll look at the original Medicare Part B, and like I said, this is the coverage: physician service, outpatient hospitals, preventive services, ambulance, home health care, and then limited prescription drugs and blood and lab services. And this is a Part A, the original Medicare that cover. Now we'll talk about also the original Medicare Part E cost sharing. The monthly premium for everyone right now is $174.70. and that actually for 2025 estimation, it would be $185. The premium actually went up almost like $10. Annual deductible, $204, and after annual deductible, most services cover 80%, as we said. Physician service, 20% co-insurance, and ambulance is 20% co-insurance as well. Home health care, there on that one there is no cost, and therapy is 20% co-insurance. And this is the original Medicare Part B cost sharing. Now look at what original Medicare doesn't cover. It's comprehensive annual physical may be covered by Medical Advantage Plan. But here's what the original Medicare doesn't cover. Hearing, dental care, routine eye exams and eyeglasses, and most care while traveling outside the United States, long-term cares, and routine food cares. And this is why this is why they said the original Medicare only covers 80%. The 20% has to come out of the pocket, and that's when you either buy a plan such as a Medigap policy. So here is the Medigap policy. So we'll talk about the Medigap policy here, how you can buy an additional health plan. So it helps to cover the original Medicare Part A, Part B, and co-pay deductible. Medigap policy sold by insurance companies or offered by companies to their retirees. There's standards, the difference of premium cost and level of customer service. And then you have only 6 months guarantee to go on Medigap policy when you're first enrolled in Medicare. So Minnesota is a waiver state, no alpha option structure for the Medigap policy, meaning that other state, they have actually a letter where in Minnesota we only have a basics and then extended basics. So basics means really, this is like, as good as it gets in terms of the coverage when it comes to the Medigap policy. It covers the most. No, this is not for diabetic. So this is anybody who has issues, problems with their food cares, going to the the doctors, meaning that it will not be covered by original Medicare. If you don't, it's not covered. Yeah, it's not covered by original Medicare. Sure, no problem. Yes, you had a question.
My parents are 70, so I'm just kind of like trying to understand some of this. A lot of this stuff is like talking about like when you first sign up for Medicare, like can you change because I noticed where you said you had 6 months or something for the Medigap. Can you change any of your coverage at any time, or how does that work?
Sure. We talked about that. So you actually, of course. No problem. I can say it again. So we have, we have OAP, open enrollment period. So October 15 to December 7. So now actually in about 2 weeks, OAP start. So you have anybody who in Medicare, they have an options. They can change their plan. They can purchase additional plans to what they have already. So those are the only time that you can change it during the year. So October 15 to December 7. If they're in Medical Advantage, they can do January 1st to March 31st. But the original Medicare that's the only time.
But does that guarantee that you will be accepted like you were before? I've heard that you have to be vetted if you want to go back to original Medicare.
You can get accepted, and of course, obviously No, she was asking if you can go back to the original Medicare. Tell, for instance, if you were a Medical Advantage, can you go back to the original Medicare? Yes, you can go back, but the only issues with that, it's when you go back. If you go back during open enrollment, you can definitely do that. You can do so. you can go back, and it's allowed, and you can get exactly the same benefit. But the only thing with this, the Medicare policy, if you did not purchase the first time and during open enrollment, and you wanted to go back to maybe original Medicare, they might not accept you. It's only Medicare policies issues, but everything else you can definitely go back.
So if you have advantage, you go back to.
Original Medicare, yeah.
Not get advantage in the future.
No, you can get advantage in the future too. So regardless, any times between October 15 to December 7, you can definitely change. You can go back and forth.
You
Yes.
go to original to,
Yeah, you can change your plan.
what do you call the other?
Advantage, yep.
Advantage, original, back and forth.
But that,
There's a problem there.
but the only time that you can go if it's like a special circumstances happens that you wanted to go. But you can't just change, but you can change your plan. The only thing that you can do, you can only change your plan during those times.
You don't get what? You can change during those times. You can't just change anytime.
Yeah. Yes.
But if you have original, if you have Medicare Advantage and you go back to traditional Medicare, you try to get a Medicare policy, it's going to be more expensive than it was. Is that right?
Well, the policy is not going to go. It's not going to be expensive because you are changed from medical advantage into original Medicare. The policy is still going to be the same, but the only problem is medical policy might not take you because you are not enrolled when you were a guarantee first 6-month period. That's the only issue.
But if you were enrolled in the 6-month period, then you would not have to pay a higher rate.
Yeah, I mean, it's not higher paid, but it's about them not being even accepting you. They might not accept you if you pass the 6-month period.
Does that make sense? They might not accept you if you pass the 6-month period.
Okay, go ahead.
Because they're going to rate you as far as what illnesses and what medical conditions you have. Isn't that right?
Yeah,
So they're going to decide if somebody has very little in the way of illnesses, then you're fine. But if you have a lot of medical problems, they're going to say no, guys.
well, when you change your plan, you're changing this plan because of your conditions, because you might be on a lot of medications, and you might want to probably go more often to see your doctors, and those are the reason why they giving you these times to change your plan, because you wanted to buy additional plan on the side so that it covers some of those services or some of those times that you will be going to the hospital. So you can definitely change. It's October 15 to December 7. If you wanted to maybe sit down and talk to our experts in health insurance, feel free to call our number. I think all of you have the Senior LinkAge Lines. If you haven't gotten the folders, there's a folders actually in the back. Please get the folders, and our numbers is in there, so you can have more one-on-one with our expert to just go over in depth. All right, okay, this is Medicare policy. And now this is the Medicare Advantage plan. So we talked a little bit about Medicare Advantage plans. It's offered by a Medicare-approved private insurance company, and it also includes Part A and Part B. Often, Part D benefit, where in original Medicare, there's no Part D. And also, must provided at the minimum all services covered by original Medicare. So everything is covered in original Medicare. They should be able covered in Medicare Advantage. Plans, the additional plans benefits, as we said, such as hearing, dental, vision. So if you go on Advantage plan, you have the additional benefits, hearing, dental, vision, food routines, eye exams. You can get all those with Advantage plan, but not on Medicare. Medicare doesn't the original Medicare doesn't cover those parts.
I have a question about that. I was on original Medicare. With original Medicare, I had to go to emergency one day, and the ambulance didn't cost anything. Now, on Medicare Advantage, if I need to go to the emergency room, $250 for one ambulance. So I don't think that's a true statement. Must provide at a minimum all services covered by original Medicare.
I mean, even in original Medicare, the ambulance, you pay 20% co-insurance. So even on original Medicare, if you're on original Medicare, the ambulance is still going to be, you're still going to be paid for the ambulance 20%. So in here, it says that it covers a hearing, dental, vision, food routine, eye exams. Those are where in original Medicare doesn't cover. But of course, all the coverage is not the same. There are some coverages that Medical Advantage also don't pay or don't cover, where you can get those services in the original Medicare. So there's two different things. So it might not be covered in original Medicare, but it might be covered in Advantage. Something that doesn't covered in Advantage plan, it might not be covered in original Medicare. So it's a little bit different. It doesn't mean that it covers, it only says that it covers, the additional, where we don't see that in the original Medicare.
Then there's another big problem with Medicare Advantage. For instance, United Healthcare is denying
Health partners.
like for letting people have treatment.
Yeah, I mean, United Health.
Health partners won't work with them anymore. They've cut, and so it's essential.
Yeah, United Health, starting 2025, health partner will not accept the United Health Care. So just to be clear on that one.
United Healthcare is listening. Medicare Advantage.
Yeah, and so I have to find a new plan. Because I'm health partners. I'm St. Louis Park Clinic in Memphis, so I'll have to get a new plan. Probably go back to UCare or use health partners.
I'm on health partners.
Yeah,
So
I'm Senator over.
I'm okay, but I feel sorry for being that.
So if you have a healthcare plan, you got to enroll, and you like your plan, and you don't change it, do you automatically get re-enrolled in it each year?
Can you repeat that question? Yes, you do. You're automatic.
Yes, you're automatically enrolled. You don't have to.
If you don't want to make any changes?
No, you don't have to enroll yourself. So once when you're enrolled, you're pretty much good to go, unless you wanted to change your plan.
United Healthcare. You have to be careful that your providers are still in the network.
Now we talk about the cost plan. So in 2019, it ended in Minnesota counties due to the federal law change. It used to be a very popular option in Minnesota. We'll take a look at those 21 counties where cost plan is available. So if you were to live in one of these 21 counties within the state of Minnesota, the cost plan would be available to you. So this is the only 21 counties that are cost plans that are available. All right. So if you ever move to those 21 counties, the cost plan is available. All right. All right, we'll talk now about the Medicare prescription drug coverage Part D. The prescription Part D plan that offers is within Medicare's, of course, there's monthly premiums that you pay. One thing also about the prescription drug Part D, each drugs has a formula list drugs that it will cover, meaning that If the drugs is not formally in the list where they say they're gonna cover, if it's not in the list, that means that you're gonna pay, out of a pocket. They will make you to pay. So one thing that about also the prescriptions Part D, just being that making sure that your plan that you're in, that they cover some of those medication that you take, especially if it's brand, I don't know, if it's generic, it might be, just the same price, but if it's a brand new, so it's gonna cost more money. So that's also one thing about the prescription coverage Part D. I don't know if you guys have heard of or not, but starting 2025, the prescription Part D drugs, it's gonna go down to $2,000. So which is gonna be a pretty good, and that is the max that people will pay out of pocket. That does help a lot. Yeah. All right, this is the Medicare Part D phases. This is a deductible phase, initial and coverage, and also catastrophic. We'll talk about this in upcoming slide. So this is the 2024 Standard Part D benefits. So if you were to pay for the Part D from anything from 0 to 545, that means that you exceed the most. So you will pay less than a 25% for your premiums. The most that person can pay is $8,000 out of the pocket. That's a 2024. So, but this will change. So maybe if you are focusing and if you're thinking about the 2025, we don't have an update yet, but we'll have next week update. That is when we do our annual update. As for right now, this is just for 2024. Oh, yeah. I mean, you can also, if you're interested, if the folks is interested, they wanted to hear, we have two type of different Medicare. So this is Medicare 101. Medicare 101 is pretty much more of for the folks who are on a plan already, thinking about changing a plan. This is figuring out the time period wise, and then also the annual update is pretty much. I believe, and I see a lot of people already in here. I'm already in a Medicare. They wanted to hear the annual update. They changed for 2025. So if you guys are interested, you could request someone will definitely come and present that as well. This is if you are in full extra help, LIS, low income subsidies benefit. So if you are in extra help, you pretty much, you really don't pay in terms of the copay. Your generics is going to be $1.55, and if it's a brand, it's going to be $4.60 in terms of for the people who are on federal poverty guidelines, and that is when you're getting helped a lot. But if you're interested about the Medicare saving programs, and you want to be helped with your Part D prescription drugs, you can reach out to the Social Security, and you can definitely apply too if you qualify. But of course, there's a guideline in terms of the incomes. So if you make incomes where it's required, if you don't pass that level, you should consider also applying for Medicare saving programs. It helps a lot for Part D. This is the 2024. This is just showing that if if this is your tax filing incomes for the year of 2024, as you see on the Part B premium is like $174, but where it says like Part D premiums, that is additional to what you're gonna pay. So the more that you're making income, so the more your premium will become. That's a takeaway from this page. So I don't want to make a lot of confusing on this one. So if you were to go to look at this ones from that perspective, and that's this additional, and then the more premium that you will pay for Part B. Getting help with the Medicare cost, definitely extra help programs, that will help a lot Medicare saving programs. A lot of people qualify for the Medicare saving program, but people are not, they don't apply for it, or they might not know about it. Reach out to the Social Security, reach out to the county workers and apply. And of course, obviously, medical assistance, and if you are on low incomes, MA. Where to go for the help? Please call the Senior LinkAge Lines, and the 80033-2433. That's our number, Monday to Friday, 8 a.m. to 4:30 p.m. And if you want to do live chat, you can go minnesotahelp.info. This is one of our database where we have a lot of informations about not only the Medicare, transportations, chores, homemaking, adult. There's more other services that you can get information. Definitely can go on that site and do live chat. Two of our partners, the Disability Hubs of Minnesota, and also Veteran Linkage Lines. If you were to call Senior LinkAge Lines and you wanted to talk to these two departments, we can definitely connect to you with those two. And also Medicare, you can definitely go on Medicare.gov plan finder. If you wanted to do comparisons, compare your plans, I will suggest you guys to go on Medicare.gov. It helps a lot. You can see a lot of information there. And Social Security Administration, call that, or maybe go on ssa.gov. And all right, that's the end of our presentations. And if you have a question, we can take a questions now.
I have heard that people generally use Medicare Advantage when they're healthy, and then when they get really old and sicker, they switch to Medicare Original. And I've heard that that's a problem because they're using more, those of us who do that, I'm not there yet, but who knows, then that's a budget problem for Medicare because I don't know why or how, but is that true? Do you know?
So like I said, remember earlier, I can't be biased, I have to be a neutral. I can't say that the people actually, will go on medical advantage when they feel normal, they don't have any conditions, and then once their conditions getting worse and they change their plan. Well, it all depends. It all depends on a person. If the person's, that's why I said, if you know from the beginnings your conditions that you're gonna have, if you need more medications, if you thinking about it, you might need more, going to hospitals more often, then you should consider what plan works for you. But I won't be able to say that, people will go on this particular plan, then they change into the original Medicare when they're not, when things are not going well. So I would just recommend, I won't say it's true, it's not true. I don't have any evidence. People usually don't tell us about that because that's their choice. But I would say that it's always to consider from the beginning what would be a benefit and what would be good for the person. And if not, if, like I said, if anybody need more information, we will always suggest it to have one-on-one with our experts.
Okay, thank you. Other questions?
Well, if there's no question, I wanted to say thank you for being here this morning, and of course, I hope this is for you guys have already on Medicare. Probably this is just a review for some of you, but like I said, if you wanted to explore more and navigate more information about the Medicare, feel free to call our numbers Monday to Friday, 8 a.m. to 4:30 p.m. And you can definitely also request an expert one-on-one if you need it in person or over the phones. And I hope this is beneficial, what you received this morning. Thank you so much.
Thank you, Mussa. That was very informative for me, and I hope everyone else had some questions answered as well. I guess I'm not speaking into the mic. I just thank everyone for coming, and wanted to let you know that next week, Ann Ellison will be speaking. She's the board co-chair of Mental Health Connect, and it's an organization that Plymouth is a partner with to reduce the stigma about mental health and support people with mental illness or emotional challenges, and especially in faith communities. So I hope you can join us and have a great, wonderful afternoon.